an extra special thank you to our esteemed panelists. I just want to remind all of our participants that the full bios on our panelists can be found at the Ascenda Institute's website, and that is ascendainstitute.org. We're thrilled to have a bipartisan panel with us this morning. All four panelists have been tremendous advocates for our fellow New Jerseyans, young and not so young, who have been suffering with mental health challenges such as anxiety, depression, suicidal ideation, and with substance use disorders. These serious issues have had such a devastating effect on far too many individuals, families, and communities across New Jersey. We are pleased to have four legislators here with us this morning, especially as we're in the beginning of Mental Health Awareness Week and just coming off Suicide Awareness Month and Recovery Month in our country. We have legislative leadership from both sides of the aisle, and equally important, it is that all four of our elected officials truly have positively impacted both the epidemics we're here to discuss this morning. We are expecting, to our audience, we're expecting Leader Greenwald to join. We hope he'll be able to join with us shortly. So when you hear me say we have four legislators, I realize you're seeing three on your screen. We're expecting Leader Greenwald to join shortly. Our legislators here today have introduced legislation ensuring laws have been enacted to help save lives, because we need to ensure that our brothers and sisters, our mothers and fathers, especially our sons and daughters, our neighbors and our friends, our colleagues, all have protective factors in place so their loved ones don't too fall victim. And saving lives mean that we have a chance to help those suffering to reach their full potential at wherever they desire to go in life and whatever they desire to do. You'll hear from our speakers momentarily. The title of our webinar today includes the strong word combating. We use this word with the understanding that to truly effectively combat, it requires shared values. It requires leadership. And yes, it requires funding. And we also emphasize momentum, because this past year and the current fiscal year are clear evidence that we truly do have momentum here in New Jersey. We have a major new initiative, NJ4S, where youth mental health will have resources that we haven't seen in our state. We've increased the numbers of certified community behavioral health clinics, also known as CCBHCs. We've increased and expanded mobile crisis service. We're just completing the first quarter of a fiscal year where funding for providers serving those affected by mental illness and substance use disorders has been increased, and in some cases, increases that providers have not seen in over a decade. There's money in the budget to shore up and to help support the workforce. There are many more examples that I'm sure we will speak about this morning. So I would just like to remind our viewers the format. The first 30 minutes, which now we have 25, our speakers will share their insights and their thoughts. And then at 10:30, approximately 10:30, we will switch to a panel discussion where you, the viewers and participants, will ask questions via the chat room. And if you'd like, you can start asking those questions now if you have a question on your mind. And then I will field those questions and I will hand them off to one or possibly more of our panelists. And that should run us to 11 o'clock. At such time we'll end. So I'm thrilled to introduce our first speaker, Senator Singleton, representing Legislative District 7, dedicated to public service. Senator Singleton fosters years of experience in various government roles. He began his political journey in 2011, winning a seat in the New Jersey General Assembly to represent the 7th Legislative District, making him a key leader in our discussion today. And I would also like to point out that Senator Singleton was a leader, a fierce leader, when it came to ensuring that systems are in place and monitoring is in place to ensure that the opioid settlement dollars we receive here in New Jersey go towards prevention, treatment, and recovery efforts. Thank you so much, Senator Singleton, for being with us this morning.
Thank you, Jim, and thank you for that kind introduction. It's indeed an honor to be with two of my colleagues who exemplify the words of bipartisanship, and especially when it comes to this issue. I think none of us sit here and look at this dilemma we face, the scourge of substance abuse, and look at it as a Democrat or Republican issue. I think we've all tried to come together to look forward and find ways that we could enhance not just the citizenry of the state, but make sure the resources that'll be coming to New Jersey, well over $600 million with respect to the opiate settlement, are used to help prevent further tragedies. It's in line with the over 14,000 that we've saw of New Jerseyans who've lost their lives over the last 5 years due to substance abuse. So I'm thrilled today to be a part of this discussion because there's still more work that needs to be done. But I'm confident that when you hear from my two great colleagues who are here, you're going to see that we are all in lockstep with this idea that we together will do what is necessary to make sure that there are more recoveries than individuals who succumb to substance abuse. And I'm really looking forward to our dialogue today. And thank you guys for having me, because I think this conversation is just too important for us to leave in the shadows. One of the things that we talk about in great detail is that at least where I live in Burlington County, and I know so many other counties, are no stigma county, meaning that there is no shame in asking for help. And we extend our hand and we do that to make sure those who are seeking a path forward have the resources necessary to do it. And I think our opiate settlement, with the way we've crafted legislation that was supported in a bipartisan fashion, will allow New Jersey to put the proper guardrails in place to help people get from a moment of difficulty all the way through to the other side where they can see recovery. So I'm looking forward to our dialogue and our conversation here today. And I'm so grateful for this great organization for allowing me to be a part of this discussion. Thank you.
Thank you so much, Senator Singleton. Thank you so much. Our next speaker, Senator Bucco. Leader Bucco, a dedicated New Jersey Republican leader, Senator Anthony Bucco brings his vast experience and insights to the forefront. With a track record of advocating for robust policies, Senator Bucco's perspectives will shed light on the critical intersections between mental health and the opioid challenges. Leader Bucco.
Thank you, Jim, and thank you to Ascenda for putting this program together. I'm honored to be a part of this distinguished panel. Each of the legislators that join us today have played unique roles in establishing policies and creating strategies in our fight against the mental health crisis and substance use disorders. You know, I think as we approach this issue, there are really three things that the state really should be focusing on, right? The first is to making sure that we continue to connect people to proven prevention, treatment, and recovery services and support groups. You know, this October is the National Substance Use Prevention Month. It's a great opportunity for parents to talk to their children, to get the word out, to start the conversation about this crisis that is really overwhelming our country. And as Senator Singleton said, my good friend, you know, we need to eliminate the stigma that goes along with substance use disorder and mental health issues. People cannot be afraid to seek help. You know, we have to be able to welcome them with open arms and have them understand that there are treatments available and that help is on the way to get them back on the right track. You know, I think what we've seen as a result of COVID, I think we'll all agree that we're seeing an increase, you know, in mental health illness, in substance disorders. And I think the two go hand in hand. Recently, there was a report issued by our hospitals that that reported a surge in teen mental health cases. We have to make sure that we have the resources available to address this surge, you know, and it clearly is a result of, I think, the COVID crisis and the loss of some socialization skills, separation, of our students from professionals where they were able to seek help in the school setting. From 2020 to 2021, the CDC has found that over 105,000 Americans lost their lives to drug overdose. 66% of those folks involved fentanyl and were in the age range of 18 to 45. And we have responded at a state level. Senator Singleton is correct that, we have really worked hard to address this issue on a bipartisan basis. And together, we've come up with a number of different pieces of legislation that have been signed into law. S 2323, which was Senator Gopal and myself, that requires opioid antidote prescriptions for those that are at high risk who use painkillers. That law was signed. That law was signed in April of 21. S 52, which was a Singer and Greenstein legislation establishing local drug overdose fatality review teams so that we could try to identify if in any particular areas there were any trends, so that we know that in different communities maybe something's going on, and we've got to get to the bottom of it and provide resources in different parts of our state. SJR 128, which was Senator Shapizi and Senator Vitale, designating July 14th as Fentanyl Poisoning Awareness Day, to help raise awareness of the dangers that go along with fentanyl and use of heroin and the other drugs that folks are trying these days. S 783, which is Senator Singleton and Senator Beach, he spoke about it, establishes the opioid recovery and remediation fund so that we know that the funds coming in from some of these opioid settlements are being used in the right place. We learned from the tobacco settlement that that money was lost to other issues. We can't afford to have that happen here. When this money is recovered, we have to make sure that that it's used for prevention, treatment, and awareness. So those are just a few things that we've worked on and that we've done. We have increased pay ranges for counselors. We've worked on a whole wide range of issues, but I think one thing that we need to recognize as a state is that one size doesn't fit all. We far too often pick a way to approach an issue where we believe one size fits all. And in this particular situation with mental health illness and substance abuse disorders, one size doesn't fit all. We need to make sure that there are outpatient options, inpatient options, long-term and short-term. It may be that an individual has to unfortunately leave the community that they're in and seek long-term treatment because returning them back to the environment in which they became addicted may not be in their best interest. So we have to have various treatment options and recognize that one size does not fit all. And as Senator Singleton said, this crisis is not a Republican or a Democrat crisis. It affects all folks. The one thing that I learned as one of the founding members of Daytop, New Jersey, a drug and alcohol rehabilitation center for adolescents, is that this affects everyone. You know, it is not a rich or a poor crisis. It is not a suburban or urban crisis. We treated adolescents from all walks of life and from all religions and cultures. So, you know, we need to really focus in on this. I'm glad to be here today. I look forward to hearing from my colleagues, but most of all from those folks that are watching today, to find out what is foremost on their minds. So thank you.
Thank you, Leader Bucco. And just a reminder to our participants out there, you can pose your questions as we move to a panel, which we'll do in the second half of this webinar. You can pose your questions via the chat room or the Q&A, and I will pass those questions on to one of our esteemed panelists. Good morning, Leader Bucco. Leader Greenwald, sorry. Thanks so much for joining us. As an influential figure in the New Jersey Assembly, Leader Lou Greenwald has long championed initiatives to address mental health and opioid issues. His strategic leadership and commitment to change make him a key voice in our discussion this morning. Leader Greenwald.
Jim, thank you very much. I'm very honored to be asked to be on this panel and joined by our friends. And, I think everybody has said it. Mental health is not, it's not a Republican or Democrat issue, and it's not a New Jersey issue. Some of the numbers that you're hearing on this panel, these are nationwide statistics. But I think what we have a unique ability to do in New Jersey, and really through the way our government is structured as a citizens-based government, to bring people from all avenues and their professional life as well as their personal experiences to govern through life experience to help find solutions to this problem. And really for New Jersey to be an incubator of ideas that can help solve this problem. So I just think, what's distressing to me are the statistics and the numbers. 1 in 5 adults are experiencing mental illness equivalent to 50 million Americans. According to the World Health Organization, depression and anxiety disorders cost the global economy $1 trillion per year. A survey by Gallup and Lumina Foundation found that more than 40% of college students had considered dropping out in the past 6 months, and most cited emotional distress and personal mental health as their reasons. 2 statistics that bother me the most are those involving our teens and young children. So the CDC's Youth Risk Behavior Study survey found that suicide rates amongst children, basically 1 out of every 2 young adults between the ages of 10 and 24, which had increased by 52%, had considered suicide. I mean, that number is staggering to me. 22% of high school students seriously considered attempting suicide. 18% made a suicide plan, and 1 out of 10 attempted suicide 1 or more times in the past year. And then the other statistic that troubled me, and I know, all of us on this panel, we have children, and we've all been, some of my fondest memories are with my son out on the ball field watching him. I listen to Troy talk about his kids and being out on the fields. And, from time to time, when you have kids that are competitive athletes, we've shown up at the emergency room for a concussion or a broken finger or, a twisted knee that you hope isn't more serious. But when you hear the numbers about pediatric and young adult visits to the emergency room for mental health, that your child has presented with something so significant that you are worried about their mental health, that you go to an emergency room, that has increased a 5-fold increase in the proportion of visits for suicide-related symptoms. That to me is tragic. And this is a trend. I think it is an indicator of unmet outpatient mental health needs. It is a byproduct of a shortage of mental health professionals. It is a failure to identify early on this early diagnosis of mental health issues that people are facing. And I think that leads us to, what can we do? We've done a lot, but what can we do to help become a national model in this? So one of the things that I am really interested in, and we saw a little bit with some of the COVID relief money that came out of Washington, we funded directly through our public schools access to mental health providers. And I believe that public education in our school systems can be a gateway to identify mental health issues. I think it does a couple things. And like in my private life, where most of my work is in the healthcare space, I've always believed that primary care doctors, your primary care doctor, he or she is the gateway to overall healthcare. They can help manage more serious diagnosis and disease. They can avoid emergency room visits. They can help with medication management. I think our public education system, where our teachers should not be expected to be mental health professionals. That's not what I'm calling for. But they have a unique ability, because of the number of children they see, the families that they interact with, to be able to identify a child in crisis. And I also think that we know that if a child is expressing some kind of anxiety, depression, some kind of mental health issue, there may be something going on in the household. A parent is sick with an illness. Somebody's lost a job. Family may be going through divorce. It could be an issue of parental abuse. There could be some outside factor that is causing this. If we can use our public schools as a gateway to connect those children and those families with a mental health professional through doing a lot of creative things, not just New Jersey based, but through accreditation and reciprocity, and through the advent of telemedicine, which is another point I want to touch on briefly, through the utilization of telemedicine to connect mental health providers with children and families, I think we can reduce these numbers. In every crisis, I believe there's a silver lining. During the pandemic, one of the silver linings that came from the pandemic, in my opinion, humbly, is the utilization of telemedicine. Before the pandemic, it was considered experimental, and it became a lifeline during the pandemic. And I will tell you, not for all cases, there is still a need, in my opinion, for doctors to physically interact with the patient, manipulate the patient, understand how some things are moving. But on mental health, and not in all cases, but I think with follow-up visits, the utilization of telemedicine and mental health has been wildly successful. The legislature and the governor expanded and extended the utilization of telemedicine. That is coming to an end. I've heard from providers that payers are reaching out to let them know that they're going to reduce the rate of reimbursement to 50% for telemedicine. I think that's wrong. I think it's outrageous. I think we, in a bipartisan fashion, need to make this permanent. As a lawyer, I think, Tony, Tony, you're a lawyer, correct? Tony Bucca is a lawyer. So, for Tony and I, if a client calls me and asks for advice, Tony, if a client calls us and asks for advice over the phone, we don't charge them 50%. The same advice I give over the phone is the same advice that I'm going to give in person. To think that we're doing that to doctors and health professionals, it's just ridiculous. It's asinine to me. And it is a byproduct of people without really understanding how do you shift to true value-based care, increase quality outcomes, reduce costs with a better healthcare outcome overall. To suggest that we're doing that, it's just outside influence, artificially lowering costs without a true understanding of what the healthcare outcome is. So that's one area that I think I'd really like us to look to. And, this access for the gateway to schools, I was very frustrated that a number of schools have eliminated this service because they said they didn't have money in the budget. We have put more money in the public education than any time in the history of this state. And I believe that the ability to provide these services, we would never reduce the meal programs at school. We all watch these commercials on TV. We love it where, children are out on the basketball court and they're getting called home because it's time for dinner. And there's one kid that's left there who doesn't have anywhere to go and doesn't have a meal to go home to. And we now provide 2 meals a day for many families in our school system. When the pandemic hit and schools were closed, we kept meal programs going because we understood how important that was. I think this access to mental health services is as important as the meal program, as phys ed, as anything else the schools do. And I think it's a program that we should get behind. And then the one last thing that I would add on the issue of opioids and addiction is I am very interested in companies that are out there and coming up with innovation. When I've talked to some people that are dealing with opioid crisis and maybe they are, taking methadone to help keep them clean and sober and to get into recovery. And part of what I've learned from interacting with these groups is that methadone is not maybe just a temporary measure to keep you clean and sober, but it may have to be for an extended period of time. The fact that we require people to go every day to a methadone clinic. In many cases, 30, 40, 50 minutes, an hour and a half away from their home one way, to travel there to wait in line to get the methadone and then to come back. I think it's not dealing with these patients with grace and dignity. It's not helpful to their recovery. It forces them to choose between their economic viability for their families, their jobs, and their financial stability. It prevents them from doing what we all do every day, whether it's carpooling, coaching Little League, all the other things that I think bring joy to your life that helps you stay clean and sober and something to fight for. And I just think it's an antiquated dinosaur mechanism by which we treat patients. Now, that being said, there have to be ways to do it safe and secure. But right now, those clinics aren't open on a Sunday. So we do remote distribution 1 day a week. And the opportunity to actually do this in a very safe and understood method to help patients stay in recovery, I think are the types of things that we ought to be investigating and looking into and finding companies that are willing to compete on that. So again, I'm going to stop there. I like to hear from people that might have questions, but it's very important to have these sessions. I think for us, this is a great group of legislators. We've all worked well together over the years. We brought a number of these legislators on to other issues around, the Medicaid crisis in New Jersey, where Medicaid rate is woefully inadequate compared to the rest of the country, and worked with other associations to help really build this. So I want to thank everybody for having us, and I appreciate the time.
Thank you so much, Leader Greenwald. I before we move to Assemblywoman Dunn, I would just like to say all of your points right on, excellent. But I would venture a guess that your point about telemedicine and reducing the rate and our need to fight that and ensure that stays as in the provider tool belt, I'd venture a guess that there are about 100 providers on this call this morning that are standing up or were standing up in their living room cheering and clapping their hands, because if that does pass, that will really, really hurt the provider community. And above and beyond the provider community, it will really endanger and hurt those patients needing care.
Yeah, and Jim, that's really the point to me. That's what frustrates me so much. We know that the payers have kept out on this. We know patient appointment compliance is up. We know medication management is up. We know that leads to less admissions to emergency room and relapses. This shouldn't need legislation, but the fact that there is a proactive nature of payers reaching out to say, hey, this is coming to an end, we're going to cut it by 50%. I would love if they would come forward and say, this has worked great, we're going to continue this. And I don't mean to poke fun at Tony and myself, but that's the truth. Our advice is the same over the phone as it is in person. It is outrageous that we would treat this different.
Thank you. Thank you very much. Our next speaker, representing the District 25, Assemblywoman Ora Dunn. With a deep commitment to the well-being of New Jersey residents, Assemblywoman Ora Dunn has been an advocate for comprehensive solutions to mental health and opioid concerns. Her unique insights into these issues promise to provide valuable perspectives. Assemblywoman Dunn.
Good morning, and thank you so much, Jim, for having me on this panel, along with my esteemed colleagues who have really provided a great overview of the work that we've done in the legislature and the issues before us. But I focused on the word that you used, Jim, right at the beginning, at the opening, momentum. And I think it's important to view it that way. In many ways, we are really at the beginning of addressing and responding to this epidemic, which has devastated so many families here in New Jersey and, of course, throughout the nation. And the reality is overdose deaths continue. They continue to rise. And we saw a major increase, right, in ER visits and these instances, especially through COVID, when we suffered from social isolation. I think it's important to note that 1/3 of our children that are in New Jersey's foster care system have either lost a parent or have a parent that's suffering from addiction. And we know that children with addicted parents, that they are 4 to 9 times more likely to also become addicted to substance substances. And so I think, I always look at it as the answer to breaking the cycle of poverty and crime is getting to breaking this cycle of addiction and trauma, the trauma that comes from addiction. And I know we've done a lot with the settlement funds, and we see from just over 1 year, we've increased our state investment in resources that address recovery, treatment, and particularly investing in resiliency for our children. But I challenge my colleagues and the governor that I think in this area we need to do more of the nearly $1 billion, $1.1 billion, right, that we'll be seeing reach the state and municipalities. The investment in the child trauma response initiative is at $2 million, and not every town or family can benefit from that, right? I like to say I'm the legislator of for District 25. We have a collection of a lot of small towns, 21 towns specifically, and many municipalities are, because of the population rate, is below that eligibility to basically implement programs and have those services. And we've discussed how addiction doesn't discriminate, right? And it affects everyone from all socioeconomic, race and ethnic groups. Dare to say every one of us has had an experience with a family member, either or personally, who has either suffered from addiction or mental illness. So like I said, there's more to do. And it's incumbent on us here as legislators that we remain vigilant in overseeing how these programs are working, how these services are reaching the residents of New Jersey. I know the state just issued the opioid abatement report. We actually just concluded the public comment period, where I believe over 500 comments from mainly, people who have lived experiences with this, who've contributed to the discussion on ways to combat opioid addiction. So there's more to do. We're seeing municipalities come out and apply and say what their intended use is, but we need to find out, the effectiveness. So I hope that we're here together again a year from now, discussing that and figuring out where the improvements are needed. And we talk about statistics and we talk about high rates that are very sobering, but I think it's important, for purposes of this discussion, the fact that we're going to be evaluating this. If we see increases, let that not necessarily translate into shortfalls. Let that translate into progress, that we know that more people are getting the services they need. And more importantly, we are destigmatizing this issue, and where people are willing to have the conversations, they're willing to seek the treatment, and that is progress to overall mental wellness. And I always like to say that actually, when you reach out and you ask for help, that beginning step, that's a sign of strength more than anything else, not weakness. So with that, I look forward to, again, continuing my work, my advocacy with my colleagues and all those in both chambers. I mean, this is an issue that you see we really come together as a legislative body to implement change. So thank you again for having me, and I look forward to all the questions and discussion.
And thank you so much, Assemblywoman Dunn. And, in speaking for a second for the provider community, if I may, we often, I think we all recognize, we acknowledge that these issues, these scourges, I believe appropriately Senator Singleton referred to it earlier, really affect everyone. They cut across all socioeconomic groups, all areas of our state. And we recognize that our issues are bipartisan issues, but I have to tell you, seeing it play out here the way we are today, and I'm sure our viewers recognize this, seeing this bipartisanship, dedication and commitment, and similar ideas. I don't think anybody disagrees with any of each other's ideas when it comes to the progress we need, is really a thing of beauty from my perspective, and I think it certainly gives us hope. And before we go to questions, I'd also like to point out that each of you And I think what's really, really impressive and inspirational, quite frankly, from leadership, that each of you recognize that we do have momentum here in New Jersey. And we are doing some things that are helping to save lives right now. And also, for instance, with the focus on NJ4S and school and community-based mental health and the CCPHCs, there are so many examples that we are setting ourselves up for a future where we could continue to combat and impact this and save lives. But again, what I find so refreshing is that it's clear that each of you know that we have so much more to do, that we really struggle in these areas, and that we have to continue to fight the fight. So I'm going to move on to the questions. And the first question I'd like to pose to you, Assemblywoman Dunn, it says, how do you view the impact of media featuring struggling with addiction on public awareness of the opioid crisis? And then there's an example that I have to say, the musical Jagged Little Pill, that was the example given. I'm not really familiar with that, but that's the question I'll pose to you.
Okay, I feel a little bit better. I don't know if I'm familiar with that either. But I'd say, I mean, say media, and just like policymakers, we all have a part in this. And there's room for improvement for sure. But you are seeing more stories, or even that there's a conversation, right, of the cause of death, which is so hard for particularly, I think about the teenage suicide rates. You are seeing it's the unspeakable, but parents are coming out and speaking to it to help others come along. So I think you see a lot in terms of outreach to get help. We recognize these instances, report it or help others. But again, I hopefully, I'm not sure about this little jagged pill. I certainly hope it doesn't glorify the use. And at the same time, recognize that we can't come at it in a punitive way to those who are in need of assistance and recovery.
And to the rest of our panelists, whoever would like to weigh in here on the very issue of social media and youth mental health. And thank God, honestly, this issue is getting more and more attention today. I think we need a greater focus and emphasis on it because I think there are so many inherent pitfalls for our kids. But would any of you else like to kind of share your thoughts on youth and media, social media, mental health?
Hey, Jim, I'll chime in. And Jagged Little Pill is an Alanis Morissette album from back in the day. So I my wife was literally, who's listening in, was texting me furiously. He was like, you know this one. And that's kind of weird. It's almost treated like Jeopardy. But I will tell you the issue in and of itself. The Federal Department of Health and Human Services conducted a study, and it said that children and adolescents who spend more than 3 hours a day on social media face double the risk of mental health problems when you think about anxiety and depression that goes along with that. And then taking it a step further, on average, our teens are spending roughly around 3.5 hours a day on social media. And having a 16-year-old at home, I think that's the low end of the amount of time my 16-year-old spends on social media. So while there's not one particular thing that we need to be focused on, we can't ignore the fact that some of the things that are coming through our social media platforms, especially into these still developing young minds, can have an impact on how they shape themselves, whether it's body perception, whether it's their view of the world, etc. And for so many of us who didn't have to grow up in that social media era, I don't think we recognize some of the challenges that befall that. I want to go back to something that all of my colleagues touched upon. They talked about the various level of resources that we're trying to identify and provide to make sure that we can address this topic moving forward. And there is a broad consensus around this idea that we want to make sure that parents, as well as children, understand that the inputs that they're getting through social media can have a detrimental effect to them, and to be judicious and guarded in how they're looking at it. So some of it is going to be around parents being parents, which I think everyone here who is a parent recognizes that ultimately it's our responsibility to raise our children. But we also want to give them the tools necessary to understand some of those challenges before us. But as the studies tell us, if we turn a blind eye and aren't paying attention, we know what it happens to so many young kids. As again, 3 hours a day in that study that the Federal Health and Human Services Department put together, double the risk of experiencing symptoms of depression and anxiety. So we got to stay close to our children and make sure that we're active and engage parents in understanding some of those challenges as well.
Thank you, Senator Singleton. And thank you to Mrs. Singleton for clearing up the Jacksonville bill for us.
Hey, Jim, though, I think that, this highlights a really important point, and that is on how difficult it is today for parents and for children, right? In this era of social media and access. And I think, this goes back, Jim, you'll probably recall this, years and years ago when we were involved in a symposium where, someone raised their hand and said, it was a parent in the group, and said, should I go into my child's room while he's in school and look around? Right.
Right.
And the answer from Father Johannan was absolutely. Right. You need to know what your children are up to. And it was the very next day that mom called and said she had gone on into her son's closet and tucked away in the back of the closet were drugs, stuffed into a sneaker. So, and she had no idea, caught completely off guard that this was going on. So parents have to be active, and, you can't be afraid to get into the middle of this stuff. You can't put your head in the sand. So thank you.
Next question. This is a long one, so please bear with me. It says, good morning, and thank you for this wonderful and needed discussion. There are two bills that both have bipartisan support that, if signed into law, could be the most significant occurrence in the field of substance use disorder, mental health, child family services, and services for those with intellectual and developmental disabilities. Both bills could result in increases to providers based on the need to decide annually. This would allow services who are not getting a contracted increase to at least keep up with the cost. Providers have been struggling with this lack of significant support for well over a decade. And then it says, would you support each of these bills? It's S-136 in the Assembly, A-1456. I believe that's Senator Degnan's bill, and A-508, and in the Senate, S-2668. That's Assemblyman Benson's bill, and I'm sure you're aware that would cause a situation where each and every year, come budget time, the legislature would have to decide based on the consumer price index if increases would be included in the budget. I realize it's a very long question and a very complicated question, but a very important question. So does anybody, Leader Greenwald, would you like to start us off there?
Jim, thank you. Yes. So I'm supportive of the concept. One of the things that I'm suggesting, though, is, and I've been working with the Hospital Association on a Medicaid rate study. And, I've talked to Assemblywoman Dunn about this as well, as participating in it with me. We're trying to get legislative participation from the North, South, and Central, as well as in a bipartisan fashion. I think that's a common theme you're going to hear from us over and over again. And I think what I would recommend is there are some key areas that we need to start with where we know New Jersey is grossly behind the curve. And what we need to be in this Medicaid rate issue is competitive with neighboring states. One of the things that has never been lost on me is that healthcare is our leading industry in the state of New Jersey, whether it's providers, payers, pharmaceuticals, research and development. We are not a traditional manufacturing state, but we are a state that can lead the way in innovation, clinical trials, research development, and quality of care. and we don't have to take a backseat to anybody. But what is hurting us is this Medicaid rate that is abysmally low, and it creates a tug of war between payers and providers. So there are 4 pillars that I talked to the Hospital Association about that I think are really very key components to increasing quality and returning value to the taxpayers and to the overall cost of the health system. And, I've mentioned a couple of them already. One is primary care, where we're struggling to find primary care doctors that can afford to take Medicaid. They lose money on every Medicaid patient they take. If they start to see Medicaid because they want to treat all patients the same, their schedule will fill up with Medicaid patients, and then we just will lose them. And it's an important stat, Jim. I don't mean to go on too long, but we have 2.1 million children in the state of New Jersey. 1.2 million, over 50% of them are on a Medicaid plan. That tells you a lot right there. In a state that is one of the wealthiest per capita incomes in the country, and healthcare is our leading provider, we have over 50% of our children who are in households that are on a Medicaid plan. So increasing this rate is important. So one is primary care. The second is we do not have a pediatric specialized hospital in the state of New Jersey. So most of our children leave New Jersey to go to Pennsylvania or Delaware for Children's Hospital of Pennsylvania, for Nemours, or go to New York. We have some wonderful facilities that do remarkable work. Hackensack Meridian has a very comprehensive plan, but certainly not easy for residents around the state to get to. And at the end of the day, families and parents deserve choices and options on who they go to. And many of our finest providers have elected not to build this specialty, this service, because the Medicaid rate is so low, they can't afford to build that program. So primary care, pediatric specialty care, mental health services, and finally, an issue that has troubled me, and I know the First Lady has taken a big interest in, and I think we all should be concerned about, why in this country, and in New Jersey is no exception, our maternal and infant mortality rate, in particular among minorities, is as high as a third world country. It is inexcusable. So those are 4 pillars that I would start, and I think it begins with a rate study. And I think if we could establish what is that rate that is competitive, and what I've argued throughout these budget debates over the years, providers are flocking to Pennsylvania. We just need to be able to compete with Pennsylvania, where you're seeing growth of this industry. And the ability to match that rate or compete with that rate in New Jersey would create economic stimulus, capital investment, and help us attract the best specialists in the country in mental health, OBGYN, pediatric specialty, and primary care to come to New Jersey, because we would be competitive.
Thank you. Thank you. Anybody else like to respond to that last question? Okay, let's move on. Thank you. Okay, having lost my youngest sister to an overdose, I can testify that the stigma associated with substance abuse plays a huge role in the recovery journey. I still encounter the stigma as I tell people that I lost my sister to an overdose. What is being done to change the dynamics of this label within the community, media, and healthcare setting? Positive change only happens in the light, not hidden in isolation of the dark. I believe some of you talked about stigma before, but would anybody like to respond to that question? By the way, that was submitted anonymously.
I'd just say, Jim, that the programs, or we have stigma-free municipalities now. It was a great start, and it's about education, right? And we're seeing that now more and more around the state and around the nation. But it starts locally, and I think we've started that process. As you drive along the road, you see, as you're entering a town, this is a stigma-free community. Those signs are indicative of the fact that the town recognizes the issue and they're working to combat it. So, and we have to be cognizant of that and work hard. You know, the sheriff's office, our law enforcement, you know, they've also joined in the stigma-free initiative. So, but it's going to take dollars, and it's going to take education.
Assemblywoman Dunn.
Sure, I just might add, you know, it's one person at a time, right? And having that education and awareness. I think again, starting at the earlier ages, we're talking about it in the schools, we're reaching students, and just seeing it. You know, we saw an investment in mobile services. It even in a variety of offerings for the state, even the motor vehicle commission, right? Those mobile units are quite popular. It's about meeting people where they're at, and just having that conversation. So if there's more of a ubiquitousness of it, they'll see it and say, oh, well, you know, or even just inquire, which we've seen right here in this Senator Bucco and my home county of Morris through our program called Navigation Hope. So again, just continuing that conversation and right, we know attitudinal shifts can't often legislate, and that's the hardest thing to change. But we do see that change. I see it in the younger generation in particular, and we just have to keep at it.
Jim, one thing I would add real fast is I think that, you know, the more we talk about normalizing mental health and understanding that part of the overall well-being of a healthy person is both physical health and mental health. And I think one of the best ways to normalize that is right at the front door of healthcare. When someone goes in for their well visit and a primary care visit, especially, and if we started this certainly with pediatrics, doing what I call a joint intake. So, you know, you have somebody get their well visit, and then you just briefly suggest, hey, we're going to connect you through telemedicine, or have you come in this other room and just do a 15-minute interview. You know, you may not, you know, you look at these numbers, maybe it affects 1 out of every 5 adults. Maybe it affects 18% of teenagers. Maybe it affects 1 out of those 10 teenagers that have attempted to hurt themselves in the last year. But if you catch that early on by going into those annual visits, you will make a dent in this. And then, by the way, as it becomes routine, to the person who asked the anonymous question, it's not just your sister, it's your son or daughter, right? This is understanding that there's nothing wrong with this person. This is no different than having another health issue where there's just maybe some serotonin in the brain has been off, and we can adjust this and we help get this adjusted one way or the other. These are minor adjustments that are identifying people in their overall health care and just making sure that we're getting ahead of these things. And as it becomes routine, I think it becomes very normal, and it's a conversation that everyone discusses. I go back to our children again. We don't let our children participate in athletics in our school systems unless they get a physical. Why would we not include this as a part of that overall conversation?
And if I just might add, it's a great point, Minority Leader. We passed legislation which was signed into law that would require the ID cards on college campuses, that would, just like you have a resource for a primary care doctor, where you go to get your dental health, we also now have how to access mental health services. So, and that's every college student now gets that when they register on campus. So I like to say from mental to dental, right? We're making sure that that it's a comprehensive approach. So it's just one example for the person who put in that question of the types of things that we're working on.
Thank you very much. There were a couple other comments, not necessarily questions, that I'd like to pass along about the point Leader Greenwald made about the stigma and the inherent obstacles for patients receiving methadone. Thank you for your thoughts on methadone. My son was on it for almost 5 years. He was outspoken about his experience and how it was surrounded by stigma. I'd love to speak to you more about that. So I encourage that participant to reach out directly to your office. Okay, and I believe that's it for the comments and questions. I believe a couple of our panelists referred to coming out of the pandemic and, you know, what we can take with us, what lessons we could take with us. I think few in this country would deny that mental health across America, certainly with our precious youth and our young people, that there is no more of a challenging, what sometimes feels insurmountable conversation in our country. And that's why events like this are so important. We know that when we combine efforts of leadership, funders, community, prevention efforts, recovery services, the legislature in general, that these challenges are not insurmountable, that we truly can overcome them. We also know that the mental health challenges of today are far too often intertwined with substance use disorders, and we fight that front in an integrated fashion, because that's what we need in an integrated fashion. We need to keep the momentum going here in New Jersey. Thank you so much on behalf of the Ascenda Institute of Health Innovation for participating. Let's keep the conversation going. Let's do the necessary work together. And I can't tell you that I would be hard pressed to find anyone that disagreed with your message here today. That powerful and that right on.